Hello and welcome back to the channel. My name is Dr. James Gill and you've joined me for another medical video. Why on earth have I got what looks like a 2000s era iPod attached to my left ear? I'm going to tell you, but in order to get there, first we need to do a little bit of, looking at my day-to-day work, some ancient parts of our nervous system, and a bit of old application of medical treatments. So, as many of you who've frequented the channel for a while now will know that on these slightly longer medical videos, I don't skim on the details. So buckle up for everything you didn't realise you needed to know about the autonomic nervous system and specifically vagal nerve stimulation. So for a year now, I've been working in the long COVID clinic, and one of the things I'm regrettably aware of is that when patients have been affected by COVID and left impaired by the infection such that their life isn't what it was, people can become desperate and will try lots of different things. Unfortunately, desperation leads to people being at risk of predators. Buy this tonic and it'll cure all of your ills. Unfortunately, I see that not infrequently, particularly when talking to patients, they're often taking random pills they've been encouraged to pick up from a health food shop. Now, please don't mistake me in thinking that I'm against supplements. Looking at my own cupboard downstairs proves that isn't so. But certainly there are many over-the-counter supplements for which there's limited evidence of benefit to anybody other than the company that sells them. So my point is, people are desperate. And when they're desperate to improve their health, they can be convinced to spend lots of money in hopes of improving the situation. And as a doctor, I want to try and mitigate, the harm of people wasting money on, these health quackery type things. So, why am I talking about vagal nerve stimulation devices? Well, I had a patient who's actually suffering from anxiety, and they purchased a VNS device and wanted to know what my opinion was. And I was honest with him, I was highly sceptical. Didn't have any information about them, said it probably wouldn't harm him, and since he'd already spent the money, he should probably carry on. However, when I was at home that night, I realised that I'd internally dismissed his purchase quite quickly, and actually largely because I didn't know anything about it. And I'm all-knowing, right? If I don't know anything about it, it's rubbish. That's rubbish. This is the thing about the practice of medicine. It's called practicing medicine, not doing medicine. As doctors, we're always learning to the degree that when I was at medical school, I was taught 25% of the education we have by the time we graduated will be outdated. So we must keep up to date and must keep learning about these new things. Honestly, I'm not sure if my house was bugged or just that my Google searches need better privacy filters, but a week after talking to the patient, Nurosym, who make a vagus nerve stimulator, asked if I'd be interested in evaluating their device in use in the long COVID clinic. So naturally, I said yes. And actually, I'm actually going to take this off, just waving it around at the moment. So first off, let's have a look at what the vagus nerve is and why there are doctors all over the place who are using vagal nerve stimulation techniques all the while. Why? Because we're taught how to stimulate the vagus nerve at medical school. This isn't some crackpot pseudoscience. Vagus nerve stimulation can be an incredibly important treatment for cardiac arrhythmias, including the potentially fatal SVT. But before we get into how we stimulate the vagus nerve, probably need to say what it is. So the vagus nerve is cranial nerve 10, and it's the longest of the cranial nerves, which is kind of hidden in the name, vagal or vagus, coming from the Latin wanderer. Now you know why we have the term vagrant, literally meaning wanderer. So the vagus nerve is the longest cranial nerve and thus has a wide range of effects across the body. And part of that is how it interacts with our autonomic nervous system. You see, it has an intimate relationship with our fight and flight responses, upregulating the parasympathetic nervous system to dampen down the fight or flight, and upregulating the sympathetic nervous system when we need to get a wiggle on. But how does this relate to the potentially dangerous cardiac arrhythmia? Let's dig into that autonomic nervous system a little bit more. The autonomic nervous system is our involuntary nervous system. Essentially, it's our autopilot. It runs our organs, our systems of the body. It just keeps us ticking along. By contrast, the somatic nervous system, this is our voluntary nervous system. It controls our muscles, it controls our senses. It makes us be. So with the autonomic nervous system, we have the sympathetic and the parasympathetic nervous system, and they're always in contrast. We have our fight and flight on the sympathetic and the rest and digest on our parasympathetic nervous system. Perhaps another way might be to say that the parasympathetic nervous system helps calm things down. So when we stimulate the vagus nerve, part of our parasympathetic nervous system, we get the release of a neurotransmitter called acetylcholine. This has a calming effect to our sympathetic nervous system, so it tries to dampen down the fight or flight. Remember, it's all about balance and competition. So with an SVT, this dangerous cardiac arrhythmia, the supraventricular tachycardia, we've got an abnormal electrical pathway that's coming up from the ventricles, and crudely we could say that the system there is being overstimulated. So in order to help the patient, we can have them do vagal manoeuvres, which will release acetylcholine. This acetylcholine will then stimulate one of the pacemaker regions of the heart, the AVN node, which will slow transmission from the atria to the ventricles. This will have a handbrake effect and hopefully interrupt this abnormal circuit that's driving the SVT, hopefully terminate the rhythm and put the heart back to its normal pattern. So we know that we want to try and stimulate the vagus nerve to switch off this abnormal heart rate in the heart, but how are we going to do it? It's actually surprisingly straightforward. We can have the patient blow hard against an open syringe with the plunger removed. We can't blow out the air from the syringe because it's only got a very small end to it. As a result, the pressure builds backwards and we get a large amount of pressure in the chest as our muscles are contracting to try and blow out that air from the lungs. So what that patient's essentially doing is a Valsalva manoeuvre. We're getting the patient to bear down, which stimulates the vagus nerve. We can try other things as well, such as putting an ice wet towel on your face or coughing really hard. They too will increase the pressure in the chest, stimulate the vagal nerve, but it's much easier to blow on a syringe. It is worthwhile noting that this is the theory behind how cold water immersion might give patients a benefit. And although a recent Nature Journal article wasn't very supportive of the short-term benefits of, ice water bathing, etc., the Wim Hof method, it's still how the theory works. For those of you who want to see how Nature wasn't supportive of Wim Hof's approach, I'll put the link in the description below. The crucial thing is that vagal nerve stimulation of the SVT is hard science. I've done it, it works, it's well-established medical practice. Heck, you can even try it on yourself if you've got a watch that can track your heart rate. Take a deep breath and then bear down. Do it for 10 to 15 to 30 seconds if you can. Initially, you will see an increase in your heart rate, but you should then see a decrease in your pulse rate because the vagus nerve is being stimulated. Okay, fine. So you've just proved to yourself vagal nerve stimulation is a real thing. But how does that relate to anxiety and the long COVID clinic? As we've just discussed, the sympathetic nervous system is essentially fight or flight, and the parasympathetic is rest and digest. Patients that have issues with anxiety, particularly those who develop a panic attack, can use vagus nerve stimulation techniques in order to break out of that panic attack, the same way we tried with that patient with an SVT. The same goes for low-level anxiety issues as well, where vagal nerve stimulation or modulation has been discussed as a non-pharmacological treatment for anxiety. Again, we're stimulating our rest and digest system, helping the patient calm down. And I'll put, again, links to those studies in the description as well. This idea of calming, resting, is particularly important in the long COVID clinic, as these patients are biologically stressed, and that's thought to relate to a lot of the fatigue seen in long COVID. Now, fatigue in itself is a difficult metric to quantify. You can get someone to put on a sheet, I think I am X amount of stress, but that's a very subjective metric, and as I say, it's hard objectively to quantify it. However, there is a metric that's come to the fore over the last few years as an indicator of autonomic activity, that being heart rate variability, or HRV. As we get higher heart rate variabilities, that's associated, and a wonderful word there that covers a multitude of sins, including the fact that the research is still evolving to substantiate that point. Higher HRV suggests better adaptability to stress, and lower HRV is associated with less adaptability to stress. Or, to reframe this, when you're in a biologically stressed state, your heart rate variability drops due to stimulation from the nervous system, our fight or flight response. When you're more rested or resilient, the parasympathetic system is dominant, so our rest and digest, raising our HRV. So when we have any infection, we're going to see a drop in the HRV because the body is stressed, it's fighting it. In long COVID, we see prolonged suppression of HRV due to chronic stressors, which are thought to be related to the various underlying processes, perhaps coagulopathies, maybe the autoimmune response to the virus. The science is currently being written here, but what we can say is HRV is suppressed. As a result of this, one of the therapies that's directed at helping long COVID patients, note I'm being very careful not to say treating here, is relaxation techniques, including those of vagus nerve stimulation. Now there's two easy options you can do at home, box breathing, or there is also the utilisation of a physiological sigh. They're both relatively similar, and I'll put simple links in the description where you can find ways to access those techniques. Interestingly enough, both strategies were originally developed for use in patients with anxiety. Well, it makes sense because both of them promote vagal nerve stimulation. They prod the parasympathetic nervous system into greater activity, stimulating rest and digest. So, as a result of this, there's been an interest in the long COVID community about using vagal nerve modulation in order to suppress the impact of raised activity of the sympathetic nervous system as a result of this infection. Then we can use HRV as a marker to more accurately address the impact of any treatments to see if we're successful in improving the patient's stress level. Then, if we see a rise in the HRV, we could argue that our approach has been successful. Hence we come to the Nurosym device, an external vagus neuromodulation device, which has been proposed as maybe an approach to helping patients with long COVID. Note I haven't said therapy or treatment there. So first things first, what's the concept of, frankly, strapping a battery to your ear in the hope of stimulating the lower regions of your brainstem where the vagus nerve exits? Sounds rather crazy, yet it's not actually very far away from other medical practices targeting the vagal nerve. There is a vagal nerve stimulator which is already being implanted in the body to help with refractory seizures. Now, let's be clear, this is not a short-term solution. Improvements in seizure activity are seen with it, but over years, and the maximal benefit is a 10-year period. And again, those are patients who are having refractory seizures, i.e. they're not responding to any other treatment. But there is evidence to support vagal nerve stimulation provides a benefit to these patients. Now, I highlight this to say we need to temper expectations with VNS devices and also stress that I'm talking about certified medical devices here. Parasym, the makers of Nurosym, have placed a CE mark on their device, bringing with it all the manufacturer affirmations of conformity, and it complies to the Medical Devices Directive in the EU. Suffice to say, don't try this at home with a 9-volt battery and a pair of jumper cables attached to your ear. I am not talking about DIY vagal nerve stimulation here. So, Parasym has been involved in some research, unsurprisingly, into the use of non-invasive neuromodulation techniques, and they provided me with some of those journal articles. Now, as we know very well, bias, real or perceived, is a dirty word. and I treated those papers as highly biased, so ignored them and went digging myself. So what did I find when I went knocking around PubMed? Well, first off was the application of non-invasive vagal nerve stimulation in stress-reduced psychiatric disorders. Okay, not quite the area we're looking at, but certainly a good starting point. This paper seems to be looking at stress modulation and seemed to demonstrate a benefit. But wait, look, the paper was funded by a vagal nerve stimulation company, and they also provided the devices too. Wasn't that nice of them? It was also very nice that the paper that they funded supported the use of their devices. I'm calling bias. Right, let's try this again. So I went back to have a look at anything with regard to neurostimulation, but I would not look at any papers if the manufacturer is involved. So I found a paper in 2014 with a study funded by Leeds University and no declared conflict of interest. Here they had a non-invasive vagus nerve stimulation in healthy humans, and they found it reduced sympathetic nerve activity. The highlights being here, again, it was an ear-based vagal nerve device, and it demonstrated heart rate variability increased and showed a shift towards parasympathetic dominance in 48 volunteers who'd used the device. Interestingly though, not only did the researchers see the desired outcome, but they also saw that reduced sympathetic nerve activity, suggesting a suppressive effect rather than just a stimulation effect to the vagus nerve. So fine, VNS has an effect physiologically. We've got a paper supporting that. But what about long COVID? Fatigue there's a major issue. Is there anything from a fatigue perspective? Actually, yes. The effect of transcutaneous auricular vagal nerve stimulation on cycling ergometry and recovery in healthy young individuals in 2013. Hold on, why am I talking about cycling if I'm connecting to long COVID? Here the vagal nerve stimulation produced a reduction in pain and fatigue during exercise. Now personally I found this very interesting, as I feel that part of the issue with long COVID fatigue is an impaired metabolism secondary to microclots causing end tissue hypoxia. And in this study we have neuromodulation on the left side during metabolic load with a perceived reduction in fatigue. Now obviously we have the problem there. Perceived reduction is very subjective. We don't have an objective measure in that study, but we do have other studies suggesting that the external vagal nerve stimulation has improved HRV, and there we've seen that it has similarly reduced fatigue. So maybe we could suggest the two would work together. There was another study in 2023 looked at, again, implanted but also non-invasive vagal nerve stimulation on, get this, heroin-induced anxiety in mice. So these mice were given heroin to induce an addiction and then anxiety. And again, they wore an ear vagal nerve stimulation device, and researchers were able to observe a reduction in anxiety due from heroin with these vagal nerve stimulation devices. I mean, 3 very different studies, all looking at the VNS, all showing a measurable and positive impact. Now, not being a heroin addict, but certainly someone who's got a lot of stress on their plate, I was actually happy to give the Nurosym device a go, especially if I can see an improvement in my HRV. Yes, with my watch, I keep an eye on my HRV to tell me, frankly, if I'm doing too much. And over the last few years that I've monitored my HRV, I know when I'm stressed, my HRV drops significantly. Normally mine's about 50 to 60. When I had COVID, it dropped significantly down to 19 and took probably about 6 months for it to recover. Similarly, when my son was born, my HRV dropped down into the 20s and 30s for quite some time. So basically, I am aware of how my HRV changes with stress, and to be honest, that gave me an opportunity to literally test it out for yourselves. So this is something that I recorded separately whilst I was prepping for this video. So I'm going to sort of interrupt the regular video for a screen cam broadcast thing. So I'm talking about the Nurosym at the moment in the regular video, and actually I've had a really unpleasant morning. Nothing major, I'm just aware that I'm feeling really stressed. I did a big run yesterday, perhaps pushed myself too hard. I've had a horrendous night's sleep, and also some nightmares, which are unusual for me. The point is that I'm feeling rather wired, and if I get like this is the time when actually I find the Nurosym is useful. So just to clarify with that, although I like the Nurosym, it's a bit of a black box. So I have independent monitoring. I've got my Whoop band and I've also got my Garmin, both of which have a stress score. They also have heart rate variability monitoring. So I know what's reasonable in the sense that they both roughly correlate. Now, with the Whoop band at the minute, it's saying my stress is 1.9, which isn't too bad, but if you look at the edge of the graph, you can see that I peaked around about 3 earlier on. Wasn't happy at that point, was, as I say, rather wired. So I'm going to give the Nurosym a go, kind of live as it were. So just putting a little bit of moisture on the tragus, sticking it on, switch the thing on, booting. So it's going for 60 minutes, we're hitting OK, and I'm going to steadily increase up the voltage. I know for myself that it's about 20, 22. Okay, so it's a bit sharp there, so pulling it back down, and we'll just hit enter, and we'll let it run for its 60 minutes now. So we've seen that my stress score on Whoop is 1.9 at the moment. Now, that could be 1.9 elephants. It doesn't really matter what the metric is. And I must confess I dislike these proprietary metrics that these companies use. But certainly from my use of Whoop previously, there is an internal consistency. So we'll run it for the hour. I'm going to get on with paperwork and we'll see how things are in an hour's time. I'm also going to run the Garmin watch now for just a health check, and that will let me get the heart rate variability at this precise moment in time. That needs to take 2 minutes to run through, so I will see what the heart rate variability is now, and then we'll also do it again at the end of the test. So there's the Garmin health check. So the important thing there is my stress in their metric is 50 and the heart rate variability is 41, which is quite moderately low for me. I tend to sit in the 50s, so 41 definitely rather sympathetically active at the moment. So we'll see what changes here. So with that in mind, I return you to the rest of the video and we'll see you shortly. So there we go, we're coming to the end of the hour, and yes, paperwork in of itself is slightly boring, which you might consider to be a form of relaxation, but let's see what our numbers are. So if we open up the Whoop app, it's just calculating for the moment, and we're down to 1 on its own. And if we look a little bit further down, we've certainly had as low as 0.5 whilst we've been using the device. So on that side of things, it certainly seems to have had an effect. But that's just one metric, and as I've mentioned, that is a sort of a proprietary number. It doesn't really tell us much. So let's load up the Garmin and we'll check the 2-minute health check, and we'll see what the HRV is at the moment. Remember previously it was down to the 40s. We want to see if there's been improvement with that. So let's load that up now. So from that we can see that the stress score has improved, and crucially the heart rate variability, which is a much better metric, has increased from 40s to 69. So with that we can say, certainly with an objective measure, using the Nurosym seems to, I'm still wearing it even though it's finished now, the Nurosym seems to have had a positive impact on myself. Am I feeling a little bit less stress? Yes. Could that be due to the fact I've been sat down doing paperwork? Honestly, I'd say not, because I'd been stressed doing the paperwork for perhaps an hour before I decided to do this little snippet. So I'm not convinced on that. Similarly, I have had caffeine this morning, and I'm quite sensitive to caffeine. That's not going to have disappeared from my system in an hour. So I'm happy to say that the intervention seems to have been effective. Perhaps we could look at doing a further test next time I get stressed like that. Just simply sit down doing paperwork and again compare with the metrics on the Garmin and the Whoop device. But to my mind, it seems to work, and I'm finding that I'm using the Nurosym more regularly to help, for want of a better phrase, calm me down and critically boost my heart rate variability. Yeah, they're expensive devices. There is lots of evidence that heart rate variability works in terms of controlling your overall health, in terms of that balancing the parasympathetic and the sympathetic nervous systems. Certainly when my heart rate variability is higher, I feel much better and I have more energy and I'm more relaxed. Conversely, I know that when I'm pushing myself very hard at work, doing too much exercise, just not looking after myself, my heart rate variability goes down. We can adjust heart rate variability with breathing exercises, but we can also use other things like the vagal nerve stimulator, which, to be honest, works for me because I can wear it whilst I'm doing paperwork and things like that, whereas it's a little bit more difficult to do things like box breathing, which work and are free, whilst I'm doing paperwork and things like that. So, yeah, I think that's probably a reasonable place to actually end the whole review, analysis, commentary on the Nurosym. So, vagal nerve stimulation is backed by evidence with regard to seizures, with depression and anxiety, and my personal experience of using the device is, well, I'm going to get one for myself, and you can't really say more than that in terms of whether or not you're going to buy into the science of a product. So we know that vagal nerve stimulation works in cardiology, in the A&E department, that vagal nerve stimulation can be generated through breathing exercises and Valsalva work when it comes to anxiety. The papers I've looked at do provide evidence of support that cutaneous vagal nerve stimulation is effective at improving parasympathetic drive. It can reduce fatigue, and personally I've seen that it improves my HRV when using this device. Now, whilst I'm not saying a VNS is a treatment option, it may be that there's potential use for patients with long COVID. But we do really need to combine it with something like HRV monitoring to a wrist device to see if there's a long-term effect. Otherwise, we appreciate that placebo effect is 20%, so we really need to make sure that any benefit the patient is seeing is because they're actually getting it, rather than merely a perceived one. I mean, even if you don't want to look at buying into a device, certainly look at vagal nerve stimulation techniques. I've highlighted box breathing, I've highlighted the physiological sigh. These are already routinely discussed in long COVID clinics. Okay, with that in mind, I think warning time. Obviously, Nurosym have lent me a device, so that's bias. But frankly, I've been very surprised at the effect when I've used their device. It's all well and good saying studies demonstrate X, Y, Z, but it's quite something to see a perceived positive effect on yourself. And there's my warning to you. That is a study of one. If nothing else, it's anecdotal. This is not good hard science. The fact that I'm telling you on YouTube I found this as a benefit does not necessarily mean this will translate to yourself. You must exert caution when looking at something that somebody is selling you. So, just doubling down on that, I've found two big benefits for the Nurosym device. I've found that it certainly helps me focus. There are studies definitely to support that. And I've found that it's improved my HRV when I've measured it. You've seen me doing that, but again, careful with the evidence that I'm providing. There is evidence to suggest that vagal nerve stimulation devices aren't a 5-minute fire and forget therapy. They need to be used for hours in a day. So if you've got a desk job, maybe actually it's going to be easier to use than you think. Certainly I've shown I'm happy to use the device whilst doing my paperwork. So I'm going to go all the way back to what I started with a patient who was asking me about vagal nerve stimulation devices. What will I say if it comes up in the discussion with a long COVID patient? I'll probably say focus on home vagal nerve stimulation first, box breathing, Valsalva manoeuvres, and if you see a benefit, particularly with HRV values, then it might be worthwhile looking at a vagal nerve stimulation device. But I'm going to strongly highlight that the peer-reviewed evidence base for long COVID and vagal nerve stimulation devices is currently being written. So I hope that's given you an overview of vagal nerve stimulation devices. I hope you've seen that I've tried to be as balanced and as evidence-based as I can on something where there is only a small amount of evidence base. So if you've got any questions, put them in the comments below and we'll see if we can get back to you on those. If you could like the video, it tells YouTube we're here, and if you've enjoyed this as a long-form video, please subscribe and hopefully you'll help us guide the channel to produce more of them. With that in mind, take care, and we'll see you in the next one. Cheerio.